Hello, hello, hello. Breaking a November 18th, 2025 national survey from the actual Princeton Review in partnership with the Rudderman Family Foundation reports double-digit gains. And these gains are in mental health services. 93% of colleges say mental health is integrated into residential life. 64% now operate fully staffed counseling centers year round. 30 institutions were named in the 2026 Mental Health Services Honor Roll. The question is no longer whether campuses are doing more, but whether students are actually better off. I'm Dr. Tarina Knight, host of Roots of Resilience Higher Ed Edition. I help campus leaders turn policy, funding, and research into repeatable care workflows that is respectful to privacy and reduce burnout. Today, I'm asking a hard question. Does growth in services equal growth in impact? First up, what the gains really represent. The Princeton Review's 2025-2026 data tells a capacity story, and it's an encouraging one. More accredited centers, more year-round staffing, more visible integration with residential life. But capacity alone doesn't guarantee outcomes. As of January 27, 2026, students still report using campus counseling at only 18%, despite 73% trust. Long-term research summarized by Higher Education Today and the JED Foundation helps explain why outcomes improve when entire systems align, not when services expand in isolation. Capacity without conversion is a mirage. The real question is whether students are getting help earlier or whether outcomes are improving. Let's take a look at funding windows and accountability. Now, add the funding context. So, on January 23rd, 2026, the Harvard Office of Federal Relations reported that Congress moved towards finalizing the final year of 20 or the first fiscal quarter of 2026 appropriations, rejecting deep proposed cuts and signaling more stability for education and health agencies. That stability creates opportunity, but also expectation. Boards and funders will ask, are wait times shrinking? Are show rates improving? Are students who engage in care persisting at higher rates? And are staff in care roles burning out less? These fiscal dollars arrive, the case won't be we added programs. It will be students waited less, stayed enrolled more, and staff sustained the work. Now, let's look at turning growth into measurable impact. Here are 4 metrics. The convert capacity into credibility. First, we have time to first contact, the TTFC. Publish median days from referral to first appointment and commit to reducing it by 25 to 30%. The second is early alert, warm handoff rate. Measure how many early alerts result in a scheduled counseling visit within 72 hours. And third, retention for students engaged in care. Track next term enrollment and validated well-being indicators for students who access services. Fourth, staff burnout trend lines. Quarterly pulse checks in counseling, care, and BIT teams. Sustainable systems reduce moral stress. Report fewer metrics, but make them count. Time to contact, warm handoff, retentions, and staff burnout. Tell the storyboard's actual need. And it helps you keep up with what your higher education institution needs to put a little bit more focus on. Because double-digit gains in campus mental health services sound promising, but are they creating real change for students? When looking at where we are today, it takes the participation in those of you that are in higher education to share your stories. Sharing your stories actually help us be able to create this assessment or screening that's needed in order to grasp the things or areas that we can actually improve in. Because even we're looking at time to contact, warm handoffs, retention, and staff burnout, those are all areas that have been researched. Maybe there are some new areas we can look at and research. If there's something I haven't said in today's episode, please share it below. Engage in the comments and let me know what it is you're experiencing and whether you feel like it will help that storyboard that helps you show what's needed in your higher education institution. Now, you guys know I've been talking a lot about FERPA and HIPAA, and mostly because I know that when we worked in healthcare in the emergency room setting, in the community mental health setting, and the institutional settings, there is always discrepancies around who information can be shared with and what information can be shared and in what circumstances information can be shared. What I may see as a crisis may not be what my fellow colleagues may see as a crisis. So you have to be able to explain those things in the event that someone questions them, but also understanding it. And that was just from the HIPAA side. So imagine when I worked as an adjunct professor, that fell over into FERPA. Now, during the time in which I taught, I kind of stayed away from talking to anyone about my students, right? Or sharing any information. The thing with that is, many times I had students that came to me that were experiencing substance use issues, or they had family issues at home that was going on, or maybe they were just struggling with their internal chemical imbalances that was impacting their ability to retain information. Whatever the case may be, I felt stuck. I knew all the resources and things that could help them, but I didn't know what could really be shared. And there's many of those that I talked to over the years that felt the exact same way. Now, why it is today in 2026, many of them now are afraid to even talk about it, or they'll just say, oh, we'll let such and such handle that. Well, how does it even make it to such and such? Do you even know what you can share and talk about so that it makes it to the proper channels? That's why I chose the approach of discussing FERPA and HIPAA. Now, is it all that I do? No. Is it all the knowledge that I have? No. It's just an important impediment or gap in the actual way that students receive service. I know that many times students and anyone that's receiving, trying to get help, whether they are a student or not, whether they're just a regular citizen out here on the street that walks in for help, what impacts their ability to get the care and access they need is knowing who information can be shared with. Many times professionals will push patients to the side, refer them to other places that they don't even fit the criteria of being in space, and they don't get the help they need, and it turns them off to things that's supposed to help them gain and maintain where they need to be successful and gain the help that they need. Comment Playbook to receive the Capacity to Impact Toolkit because I would love to share that with you. It has a calculator, a warm handoff, SOP, and a board-ready outcomes brief. These are all tools to help you be successful in your role in higher education or behavioral health or in healthcare, because now we're bringing healthcare into the higher education arena. And it is important for those of you that work in primary care or specialty to know what to do. And that's what my services is about. I kind of like to go into 2026 looking at myself more as an advisor, someone that gives tools and recommendations, but also seeing how I can be of a support. Do I have clients currently? No. And that is the point of all that I do every day to provide education so that the right individuals come to me that need support. And if you're unsure of my knowledge and capabilities, schedule a strategy session with me and let's have dialogue so you can learn what it is I do know versus don't know and whether those things fit your environment. But what I find to be exceptionally challenging is when professionals find themselves to be so professional, they're not willing to acknowledge where help is needed. And we all can use help. I ask for it whether I get it or not. But keep moving forward and never allow the lack of anything in your life to prevent you from being successful. And if you need to know how to prompt AI in healthcare, behavioral health, or higher education prompts, let me know. I would love to share with you great ways in which you can get the support you need right at your hands and fingertips without ever needing the support of anyone. Consultation with those that are in your field is helpful, but many times we have individuals around us that typically don't know more than we do. And that can be concerning because who do you go to with those challenging questions if everybody's on the same mentality or what page you are? Think about those things as you are navigating your level of care. And those of you that are in higher education and leadership, you say, oh, well, I don't work directly with the students, or I just manage the faculty and staff. Well, know that your small piece that you consider to be irrelevant is very relevant. Because if you participate in creating policies and procedures, then you are participating in the outcomes of those that are around you. And if they're not crafted appropriately and with strategic mindsets, with evidence-based facts that are not one-sided, but presents itself with both sides, then you are creating biased environments. I like to share the research from both sides. And if there isn't research, I like to explore ways in which we can gain that information that we need so that both sides are addressed. Because we need to see the effectiveness of both sides before we can discredit it. Now, what people dislike about AI is that research shows us that the error compared to human is less. So we actually have more human error than we do AI error. Now imagine humans are creating AI protocols and various different things, and AI is learning from humans. So their error actually comes from the error already there through human beings. So to discredit something that has the potential to be so much more just speaks volumes of how defensive we are as people. I'm Dr. Tarina Knight. I'm a doctor of behavioral health. No, I'm not a medical provider. I do not hold a license. I focus in consulting and coaching. If you're ready to convert growth into outcomes with privacy competent workflows, visit me. You can search me across any platform as Virtually Renowned Consulting Access LLC. When you type that in your search engine, you will have my website pop up. If you click on it, it gives you access to all my social, all my podcasts, my previous information, as well as any courses and things you find that you would like to know more information about. And feel free to email me at tnight@virtuallyrenownedconsulting.onmicrosoft.com at any time. I would love to hear from you. You can also call me at 1-984-677-4191. But stay with me. My next episode is on how state privacy and AI laws quietly reshape campus risk in 2026. And no, until next time, never feed the beast, never fed the beast, work hard, stay peaceful, and remember to build roots of resilience. And remember, I'm here for you. So if you need help with building those roots of resilience, reach out to me today and